disease. It claims 1 in every 7 lives in the U.S. And of that, 1 in every 3 women will die from heart complications. We're going to change those statistics. At least that's what we're hoping to do. Today, we're focusing on women and heart disease and steps that every woman can take to help reduce their risk. So we're here with Dr. Kardie Tobb, Cone Health Cardiologist and Medical Director for the Women's Heart, Health, and Cardio Obstetrics Clinic. So we are talking to you about what every single woman needs to be talking about and thinking about right now, which is women and their heart disease. So at what age should a woman start making their heart health a priority?
Thank you, Tanya, for having me. I'll say they should start today. I think every adult woman, even as a teenager, should start with a healthy journey on how they take care of themselves in terms of their heart health and what they eat. Because the thing about it is 80% of heart disease is preventable. So I would ask every woman to start looking at their heart health today.
Okay, well, so you guys are kind of helping women do that. Cone Health is offering a free community event for women all about heart and heart health. So tell us about that event, when, where, and the whole thing.
Oh, we're looking forward to this. It's going to be on February 2nd, and that's going to be at Union Square, Gate City Boulevard. We have been doing this for several years now. This is our 3rd year, and we look forward to that on National Go Red Day, which is the first Friday in February, to get women together of all ages, socioeconomic backgrounds, to just talk about what it is to be able to take care of your heart, what you need to do, what are the preventative measures, because I said 80% of what happens in heart disease is preventable. So on February 2nd, we'll be looking forward to that.
Okay, so what happens when people go to Union Square? What will they find?
So it's going to be, I'll give you a quick rundown of the day. What was going to happen in the morning, we have sessions from some of our cardiologist colleagues, some of the pharmacists who are going to come by and talk about high blood pressure, what can you do, talk about nutrition, talk about stress in the heart, and just how you as a female can really take care of yourself to prevent some of these. The afternoon is going to be exciting. We're going to have short classes, sessions that people can really pick their own path, where you can either do a cooking demonstration or you can learn about a calcium score test that we usually look at for preventing heart disease and understanding what's your risk for heart disease. Or you can take the path where you do exercise classes with our friends from Sagewell. So it is an exciting day to look forward to.
Okay, do we need to register ahead of time, and do we do that online?
So yes, so the great thing about this is we have the registration online. People can be able to pick their timing. Most of the great activities in the afternoon, you can come in because the seat is limited. The morning sessions are limited on seating, so there may be restrictions there if someone does not get to it in time for registering. But yeah, this is going to be an exciting day. The one thing that we're looking forward to on that day is to empower women, to help women understand that you can actually take care of your heart health by just knowing what you need to do, knowing your numbers, understanding your family history, knowing what the healthy tracks are that you can take and make your life a healthier pathway as you go forward.
Yeah, because it seems overwhelming at the get-go, but you're going to put it in bite-sized chunks so that we'll be able to figure that out by the end of the day. Okay, so women's bodies, they go through all kinds of unique changes throughout time. So during and after pregnancy, menopause, could these stages and changes impact their hearts? What should they be looking for?
You're exactly right, Tanya. The stages that women go through, starting from their premenopausal years and through their years of women who get pregnant, there are some things they get exposed to during pregnancy. For example, if they have high blood pressure during pregnancy, diabetes during pregnancy, those predispose them to early heart disease. So these are the things that women need to start looking at when they've had these experiences during pregnancy. Of course, menopause have had some takes on the traditional ways of how people, when you lose certain protection and you also have high blood pressure, diabetes can lead to high risk factors for heart disease. But those are some of the things we're going to be talking about on February 2nd, really, to help people understand what the steps you can take for early detection and prevention, and how do you live with heart disease if you have heart disease. This is not just for women who want to prevent, women who already have heart disease. What do you do? How do you really take over your life with having high blood pressure? What are the things that you can do to help control it? So yes,
okay,
those are the steps.
So it's exciting that people can go to this event now. If you can't go to the event, we're going to do kind of like a mini event right here, right now. What are some symptoms of heart disease in women that many times women think are just related to something other than their heart?
So when we think about heart disease, the typical symptoms we all think about is chest pain. Some people think about shortness of breath, but I like to remind women that are listening to us today is you're not just only going to experience chest pain. It can come in a form of the fact that you've been tired for a couple of days. You just can't do the things you used to do. You feel dizzy or lightheaded. One of the most important things is knowing what your baseline is, meaning how are you every day. When you start to go a couple of days that's outside of your norm, please talk to your primary care provider. Please talk to someone because you could be really harboring something that could be devastating for you, like a heart disease, a heart attack, or something like that.
I think we pass that off because we're like, it's just been a rough week. We've just had a lot of stuff going on.
Of course we do, because we're busy. We take care of everybody else. We have to get the kids to school. We have to make sure we get to work. We got to make sure our projects are in. But we have to step back and really appreciate the fact that we need to empower what we need to do for ourselves. We need to make sure that we're fine because we can't take care of everybody else if we're not doing well ourselves. So that's the one thing I think women, we need to understand that it's not tomorrow, it's not next week, it's not after I give my project, it's actually today. I don't feel good today. I'm going to stop and I'm going to take care of myself.
All right, sometimes we think we just have a tough week. Oh, I'll get to the doctor later. Is there something, how can we make it easier for women to do that?
I think there's multiple ways that we can do those things because the first thing is if the woman is already established with a primary care provider, take the first step, call the office, see if they're able to see you. And there are other options that you can take, like the virtual visit option, look, the telemedicine, pretty much that is. And if you don't have a primary care physician or provider, these are other steps too. And I know our organization, we're able to connect people to care, make sure that people have the right types of screening that they're able to do once they're connected to this care. But what I like to say though, to any woman that's really listening today is, please don't wait. Today is the day. The day that you are feeling ill, the day that you feel you have that tiredness that can't go away, the day that you're having that chest pain, is the day that you really need to call in and the day that you need to seek care. So that's really important. And if you feel that you're not able to do that, 911, those are always the ways that you can make sure, because there are times where you can get to a point where we may not be able to do too much, but we can prevent any type of devastation from happening if you come in early.
All right, well, let's talk about that. Let's talk about a few prevention strategies for maintaining a healthy heart, like eating and things of that nature. What should that look like, the do's and don'ts?
So we talk about that 80% of heart disease is preventable. So those things that you can do, first of all, consider how you eat. Like look at your diet, look at those things that you put in your body. For example, you can stay away from fried foods, decrease the high sugars, select something like fruits and vegetables, cut down on the carbs, look at the way you're eating, cut down on sugary drinks. Those really help. Lean meats like chicken and fish actually helps. The second thing that you can really do is start adapting how you really see yourself in the physical realm. Exercising, walking more, 30 minutes a day, start gentle and go more. The other thing that you can do is know your numbers. Talking about establishing yourself with a primary care provider, knowing what's your blood pressure number. Is that number less than 130/80? Knowing your cholesterol number, and that's just a panel of blood work that you're going to get to know if you have high cholesterol, knowing your blood sugar. Do you have diabetes? Because that will really empower you, because when you know these things, it's going to help you. The other thing that I would like to let women to know about is what we call coronary calcium score. If you have a family history of heart disease already and you know that history, if you have high blood pressure, diabetes, you really want to know what that coronary calcium score number is if you're already building up calcium, because then we can be more rigorous on how we help you to prevent the worsening of that situation that you may be in. So empower yourself. There's nobody else that can really do that better than you can. So do it today. Just start today. If you need guidance, we're going to be there on February 2nd at Gate City Boulevard. You're going to be able to meet other women, empower and just inspire each other as you go on the journey of healthcare. So we're excited to be able to do this for the community.
Yeah, and we'll put a link to that February 2nd event as well. You said know your calcium score. How do you get to know your calcium score? Is that just a test or a blood test or?
Thank you. I'm glad we came back to that because I really want to talk a little more about this. The calcium scoring tool is a CT scan essentially. You have to really meet certain criteria, like your age over 40 and high blood pressure, diabetes, and it gives you a certain number. If you're in that bracket, it's a CT scan that you can be able to schedule and do. And that really helps predict what you had, because if you have a zero number, that means like, okay, you haven't built up calcium. But if you have a family history and you do have that, it helps us really guide you in what you need to do for the next step of prevention. So that's really important. So think about it this way as a mammogram. Like most women get their mammogram every year. It's almost like that. The difference is that you can only do once, you know? So think about it that way, because it's something that really guides that process of knowing what you have there and already empowering yourself how you move forward.
Okay, we've got a little bit under a minute. What about smoking? How does that figure in?
Smoking plays a big part of this, and thank you for bringing that up, because smoking is one thing that if you're a smoker, you want to quit. And I like to share with the audience that we do have, if you go to conehealth.com/smoking, you can find tools there that can help guide you on how you can quit smoking and maintain being a smoke-free person.
Okay, great. Thank you for your time and expertise. And again, we will put that link for that February 2nd event in the To Wants to Know section, although to your well-being section as well.